Hi, my name is Dr. John Robinson.
And I'm Dr. Christina Bosch.
And we're coming to you all the way from the hormone zone today. And we're both physicians where we focus on hormone replacement therapy, anti-aging medicine or age management medicine, sexual wellness, and even regenerative medicine.
And we're also sometimes known as
the sex docs, right?
Sex docs.
So what do we have for you today? Today we're going to talk about something that we're extremely excited about, something we've been having some amazing results here with our patients. It's something called CJC 1295 and ipamorelin. So what exactly is that? It's a peptide, right?
Yeah.
So this peptide therapy is really something it's the wave. It's what the future holds for us in terms of anti-aging medicine. We're going to see more and more about
potentially hormone replacement to a certain extent.
Yeah.
Yeah.
Because essentially that's what these are. These little peptides are actually small little hormones that are very natural to the system, and they communicate with different parts of the body. And in this case, it's going to be about how can we stimulate growth hormone in your body naturally.
That's right. Yeah. So.
Well, let's get into it. What does growth hormone do for us? What does it do for us?
Kind of a little bit of everything. Think of any of the primary symptoms that maybe brought you to our door in the first place, whether it's prevention or restoration of osteoporosis, or whether it's beauty goals like increased collagen and elastin, or hair, or brain function, memory, mood.
The list goes on, right? This is what growth hormone does in a nutshell. It's a recovery hormone. So where, yes, it definitely helps with muscle and bone, but it helps us to recover. It really has a lot to do with helping us sleep. So if we can sleep more deeply, we make more growth hormone. We make more growth hormone, we recover.
That's right.
Yeah, and I think all of our patients, in one way or another, are kind of like athletes. They're out there really trying to kind of kick butt.
Yeah, it's optimization.
Yes, for sure. And growth hormone helps with that. So how do we get this growth hormone optimized in the system naturally? Because there's different ways to do it. So what we're talking about here is this CJC and ipamorelin to be able to really stimulate growth hormone naturally in the body. And they kind of do two different things.
Right, so one of the concepts with growth hormone is that we need to produce more because production does decline a bit with age. But the other concept, is that how well is the growth hormone that you are producing being released into the system so that your body can actually benefit from that recovery hormone?
Yeah, that's a great point. Look, a 20-year-old man or woman has the same amount of growth hormone in their pituitary, and that's what we're looking at here, the pituitary, as a 100-year-old man or woman. The problem is with the 100-year-old, they just can't get it out.
It's like locked.
Yeah, it's locked in there. So there can be certainly conditions where there's a real lack of production, but for the most part, in the normal adults, they just have a decline of secretion of their growth hormone.
So how wonderful is this concept, like Dr. Robinson said, that this is a naturally very non-invasive program where you're taking in something that is helping your own body release more of the growth hormone that you have locked in. So you're just maximizing your own potential for optimization.
Yeah. So to get a little bit more specific, the ipamorelin is actually dealing with the amount of growth hormone coming out of each of these cells that have the ability to make growth hormone or secrete it. And then the CJC is kind of lighting up the number of cells that can actually secrete and get rid of this growth hormone into the system. So it's pretty exciting, right? I think it is, don't you think?
I think it's brilliant.
Well, look, it's brilliant. Well, certainly the patients are saying it's brilliant.
Yeah.
Because we're starting.
Well, and personally, I can say it's brilliant.
We're both patients for sure. I'm a better patient than she is.
Well, he's more compliant.
Yeah, maybe that's what it is.
Oh, for sure. But since you're bringing it up, you're bringing it up from a personal perspective, this is definitely that thing that helped me get past that second baby recovery.
Yeah, yes.
I like to say, I just had a baby. It was 3 years ago. So definitely having the assistance in releasing that growth hormone through the CJC ipamorelin has allowed me to build more muscle and burn more fat. So literally, I'm in the best shape I've ever been.
Absolutely, and I can attest to that. Well, come on. But anyway, look. When you got down to that last bit, it was that last 3 to 5 pounds to get to where you were looking for. I think this wound up, in your particular case, being the real big
hands
change.
down. It was definitely the catalyst for that final change. So yes, thank you. Next.
Okay, what else do we
I
have?
love
So,
you.
I love you too. So, what exactly would you expect? So, if you're deciding to do CJC along with your hormone replacement therapy or anything else you're doing here at the Hormone Zone, what would you expect? And really, within the first month, we start to see some pretty good changes.
Yes, and then start with the fact that you start with sleep improvement. I mean, there's no way that a person can lose fat or recover from a hard workout if you're not sleeping well. So you get that pretty immediate response of improvement in your sleep, but then it goes on from there.
Right, right. So, and then where eventually, by the time you get down to that month, it's probably where you're starting to see the weight loss. But this is an ongoing situation, and everybody's a little different. It might be you need to continue to be able to see these results,
Yes.
but in general, this is what we
Yes,
tend
of
to
course. I mean, that's a great point. Like with everything else that we do, there's many factors to this. That's what makes what we do at the Hormone Zone so important. It's an individualized approach because you are going to ultimately have individualized results. But the fact that it's ongoing means that we're expecting that you're going to have that assistance from your own growth hormone production from an ongoing perspective so that you get that graceful aging for always.
Yeah. So let's talk a little bit about what else it's doing and what are some of the comparisons here. I think what we continue to say here and what we've been noticing over the many months that we've been doing this now with patients, that it works very synergistically with the sex hormone
Yes.
replacement therapy that
Yes.
many of our patients, of course, are already doing. So there's an adjunct here, there's a synergy that's going on with testosterone and estrogen and progesterone along with this particular therapy.
Yeah, so you're just maximizing the efforts that you're already investing. But then the other component is something that's a very practical and real concern, which is it's cost effective. People have heard of human growth hormone replacement, but it's quite cost prohibitive for many people. And with the peptide, there's no side effect profile, or I like to say, barely any side effect profile. That's
for the most part, we haven't seen any kind of side effects with these particular peptides.
Yeah.
With growth hormone therapy, though, we do sometimes
Yeah.
see some water retention, maybe some insulin resistance that can happen for some patients in the long run being on actual human growth hormone that, by the way, is about $1,000 or more per month. Some patients
Yeah.
are doing that, and we have patients that are looking at that particular
and they may
exclusive
need
thing.
it.
And they might
I mean,
need
you
it,
know.
and it's beneficial, but
Right.
that's not at all what we're talking about with this, so you're right, it is a lot more cost effective. So here's the deal too. If you're gonna test it, and there's different ways to test
Right.
it, and you might even have
Important.
seen this before, maybe your doctor, some other doctors maybe checked it for you, something called IGF-1 in your blood. And we do routinely check that, but it's really not the best way to do it. It's okay, but it's not the best way to check where your growth hormone status is. We've got a really specialized test. This is a urine test, a 24-hour urine test.
So you collect yourself at home.
Yes, so it's a lot easier, it's non-invasive, and it's actually measuring growth hormone. We actually send this out to Austria, and the results come back from a very specialized lab in Europe. So we're really getting some good results that way to be able to see what baseline is and actually seeing those levels increase as patients are on this particular therapy.
And it's because of this test that we've been able to say to more and more patients, you don't need to do HGH. You can try doing your peptides because yes, you're deficient, but you're not in such a grave situation where the direct, more expensive hormone is a must.
Right. We're taking healthy people, we're making them healthier.
That's right. That's huge.
It's all about optimization. All right, so, and you can see a little bit about the dosing strategy and what it is. It's a very simple subcutaneous injection with an extremely small needle. Very simple to do. Patients don't really have any issues with that.
Even me.
Even you.
I complain about all of it. So.
So if you have any questions about how CJC and ipamorelin can help you, make sure you contact the office. Ask us any questions. We're here for you to be able to help. Because I think growth hormone could be something to be able to help, right? So again, my name is Dr. John Robinson.
And I'm Dr. Christina Bosch.
And we're coming to you all the way from the Hormone Zone, where it's better health.
And better living.
See you next time.